Prediabetes, it is also called as impaired glucose tolerance. It is a condition in which blood sugar is higher than normal blood sugar level, but it is not high enough to be type 2 diabetes. Prediabetes is a warning of type 2 diabetes because without intervention, it is likely to become type 2 diabetes within 10 years. Also, if you have prediabetes, you are more likely to develop type 2 diabetes, heart disease, and stroke. Prediabetes is a component of metabolic syndrome. So, what causes prediabetes? Prediabetes usually happens when your body has a problem with insulin. Insulin is a hormone that helps the glucose get into your cells to give them energy. So, a problem with the insulin could be because normal glucose homeostasis is controlled by three interrelated processes. These processes include gluconeogenesis, that is, glucose production that occurs in the liver, uptake and utilization of glucose by the peripheral tissues of the body, and insulin secretion by the pancreatic beta islet cells. The presence of glucose in the bloodstream triggers the production and release of insulin from the pancreatic beta islet cells. The main function of insulin is to increase the rate of transport of glucose from the bloodstream into certain cells of the body, such as striated muscles, fibroblasts, and fat cells. It also is necessary for transport of amino acids, glycogen formation in the liver and skeletal muscles, triglyceride formation from glucose, nucleic acid synthesis, and protein synthesis. In individuals with prediabetes, a failure of pancreatic hormone release, failure of targeted tissue to respond to the insulin present, or both can lead to blood glucose rises to abnormally high level. Researchers think that being overweight and not getting regular physical activity are the major factors in causing prediabetes. So, what are other conditions where glucose levels are elevated? Depending on that, there are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is, or it is also called as insulin dependent diabetes. It used to be called juvenile onset diabetes because it often begins in childhood. Type 1 diabetes is an autoimmune condition. It happens when your body attacks your pancreas with antibodies. The organ is damaged and doesn't make insulin. Your genes might cause this type of diabetes. It could also happen because of problems with cells in your pancreas that make insulin. Many of the health problems that can come with the type 1 happen because of damage to tiny blood vessels in your eyes called diabetic retinopathy, nerves called diabetic neuropathy, and kidneys called diabetic nephropathy. People with type 1 diabetes also have higher risk of heart disease and stroke. Treatment for type 1 diabetes involves injection of insulin into the fatty tissue just under your skin. You might use syringes, insulin pens that use pre-filled cartridge, and a thin needle, jet injectors that use high pressure air to send a spray of insulin through your skin, pumps that send insulin through a tube to a catheter under the skin of your belly. A test called as A1C blood test estimates your blood sugar levels over the previous 3 months, and your doctor uses it to see how your blood sugar is controlled. That helps them to know your risk of complications. If you have type 1 diabetes, you will need to make changes including frequent testing of your blood sugar levels, careful meal planning, daily exercise, and taking insulin and other medications as needed. Now we'll talk about type 2 diabetes. Type 2 diabetes used to be called non-insulin dependent or adult onset diabetes. but it has become more common in children and teens over the past 20 years, largely because of more young people are overweight and obese. About 90% of people with diabetes have type 2 diabetes. When you have type 2 diabetes, your pancreas usually creates some insulin, but either it is not enough or your body doesn't use it like it should. Insulin resistance: when your cells don't respond to insulin. Usually it happens in fat, liver, and muscle cells. Type 2 diabetes is often milder than type 1 diabetes, but it can still cause major health complications, especially in the tiny blood vessels in your kidneys, nerves, and eyes. Type 2 also raises your risk of heart disease and stroke. People who are obese, more than 20% over their targeted body weight for their height, have an especially high risk of type 2 diabetes and the health problems that can follow. Obesity often causes insulin resistance, so your pancreas has to work harder to make more insulin, but it is still not enough to keep your body or blood sugar level where they should be. Treatment for type 2 diabetes involves keeping a healthy diet, eating right, and exercise. Some people need medication also. Your doctor might do an A1C test a few times a year to see how well you have been controlling your blood sugar. Next is gestational diabetes. Pregnancy usually causes some form of insulin resistance. If this becomes diabetes, it is called gestational. Doctors often spot it in middle or late pregnancy. Because a woman's blood sugar level or blood sugar travel through their placenta to the baby, it is important to control gestational diabetes to protect the baby's growth and development. Doctors report gestational diabetes in 2% to 10% of pregnancies. It usually goes away after birth, but up to 10% of women who have gestational diabetes get type 2 weeks or even years later. Gestational diabetes is more of a risk for the baby than the mother. A baby might have unusual weight gain before birth, trouble breathing at birth, or a high risk for obesity and diabetes later in the life. The mother might need a cesarean section because of an overly large baby, or they might have damage to their heart, kidneys, nerves, and eyes. So, what is diabetes mellitus? Diabetes mellitus, also called as diabetes, is a term for several conditions involving your body turns food into involving how your body turns your food into energy. When you eat a carbohydrate, your body turns it into a sugar called glucose that sends that to your bloodstream. Your pancreas releases insulin, which is a hormone that helps move glucose from your blood into your cells, which use it for energy. When you have diabetes and don't get treatment, your body doesn't use insulin like it should. Too much glucose stays in your blood, a condition usually called high blood sugar. This can cause health problems that may be serious or even life threatening. There is no cure for diabetes, but with treatment and lifestyle changes, you can live a long, healthy life. Diabetes comes in different forms depending on the cause. So, what is prediabetes? Prediabetes is when your blood sugar is higher than it should be, but not high enough for your doctor to diagnose diabetes. More than a third of people in the United States have it, but most of them don't know it, right? Prediabetes can make you more likely to get type 2 diabetes and heart disease. Exercising more and losing extra pounds, even as little as 5 to 7% of your body weight, can lower those risks. So, what is diabetes insipidus? Diabetes insipidus is a rare condition that causes you to have an almost unquenchable thirst and your body to make a lot of urine that is colorless and odorless. Most people pee out 1 to 2 quarts a day. People with diabetes insipidus can pass between 3 and 20 quarts a day. The main type of diabetes insipidus include central, nephrogenic and pregnancy related. So, what is the difference between diabetes insipidus and diabetes mellitus? Diabetes insipidus is a different disease from diabetes mellitus. Their names are similar, but the only thing they have in common is that they make you thirsty and make you pee a lot. If you have diabetes insipidus, the hormone that helps your body balance liquids don't work. Only 1 in every 25,000 people gets this condition. With diabetes mellitus, often shortened to diabetes, your body can't use energy from food like it should. It is far more common. Around 100 million Americans have type 1 or type 2 diabetes. So, what are the signs and symptoms of insulin resistance? Prediabetes typically has no distinct signs or symptoms except the sole sign of high blood sugar. Patients should monitor for signs and symptoms of type 2 diabetes mellitus such as increased thirst, increased urination and feeling tired. So, how is prediabetes diagnosed? Prediabetes can be diagnosed with three different types of tests, that is GTT, that is glucose tolerance test, FVG, that is fasting plasma glucose, and A1C test. Glucose tolerance test, when your blood sugar level of 140 to 199 milligram per deciliter 2 hours after ingesting a standardized 75 gram glucose solution. So, and if fasting plasma glucose test, which measures your blood sugar at a single point in time, you need to fast or do not even eat or drink for at least 8 hours before the test, and the results of the test are given in milligram per deciliter. A normal level is 99 or below. If you have pre-diabetes, then it is 100 to 120, and if you have type 2 diabetes, then it is 126 and above. A1C test, which measures your average blood sugar over past 3 months. The results of A1C test are given as a percentage. The higher the percentage, the higher your blood sugar level have been. A normal level is below 5.7%. Prediabetes is between 5.7 to 6.4%, and type 2 diabetes is above 6.5%. So, what is the treatment? The primary treatment for prediabetes include lifestyle changes such as exercise and dietary adjustments. Some medications can be used to reduce the risk associated with prediabetes. There is high rate of progression to type 2 diabetes, but not everyone with prediabetes develops type 2 diabetes. Prediabetes can be a reversible condition with lifestyle changes. For patients with severe risk factors, prescription medication may be appropriate. The American Diabetic Association recommends that prescription medication can be considered for those with prediabetes, including those in a specific subgroup who are more likely to have greater benefit from medications and are at a higher risk of progressing to diabetes. This subgroup of people include those with BMI greater than 35, age less than 60, women with a history of gestational diabetes, a fasting plasma glucose greater than 110 or an A1C greater than 6%. This may also be considered in patients for whom lifestyle therapy has failed or is not sustainable, who are at high risk of developing type 2 diabetes, or who prefer to take medication. Metformin and carboes help preventing the development of prediabetes and also have a good safety profile. Evidence also supports thiazolidine, but there are safety concerns and data on newer agents such as GLP-1 receptor agonist, DPP-4 inhibitors, or meglitinides are lacking.